America awakens to 2026, facing the most severe healthcare affordability crisis in decades, with millions of families watching their insurance premiums more than double overnight as enhanced ACA subsidies expire, triggering a renewed national debate over whether the United States should finally embrace universal healthcare or continue its reliance on the private insurance system that's failing unprecedented numbers of Americans. The numbers tell a story of systemic collapse that extends far beyond typical policy disagreements. Over 20 million Americans who rely on Affordable Care Act marketplace plans are experiencing an average premium increase of 114% as enhanced tax credits disappear, transforming what were manageable monthly payments into budget-crushing financial burdens that force impossible choices between healthcare coverage and basic necessities like food and housing. The human impact is immediate and devastating. Sarah Provost, a small business owner from Arizona, watched her family's monthly premium skyrocket from $969 to $1,800, an annual increase of nearly $10,000 that represents a significant portion of her family's income. Her story echoes across millions of American households where parents are calculating whether they can afford to keep their children insured or must risk going without coverage entirely. This healthcare affordability emergency has reignited the fundamental philosophical battle that has raged in American politics for over a century. Should healthcare be considered a right guaranteed by government, similar to systems in every other developed nation, or should it remain a market-driven commodity where individual responsibility and private competition determine access and pricing? The case for universal health care has gained unexpected momentum from the current crisis. Senator Bernie Sanders, who has championed Medicare for all for years, argues that the current premium explosion proves the fundamental inadequacy of a healthcare system built around private profit rather than patient need. Millions of Americans remain at jobs they hate for one reason: the health insurance they receive, Sanders stated recently. That's absurd. Universal healthcare will give Americans the freedom to choose the work they want without worrying about healthcare coverage. Public Citizen's recent analysis adds compelling economic arguments to the universal healthcare case. Their research indicates that Medicare for all would cost approximately $37.8 trillion between 2017 and 2026, while saving around $5 trillion compared to current healthcare spending. These savings would come from dramatically reduced administrative costs and the government's ability to negotiate prescription drug prices, eliminating the complex web of insurance company bureaucracies that currently consume massive resources while adding little value to patient care. The administrative efficiency argument resonates particularly strongly as Americans struggle with insurance company denials, prior authorization requirements, and coverage gaps that leave patients responsible for unexpected bills even when they believe they have adequate insurance. Under a single-payer system, these administrative barriers would largely disappear, replaced by a streamlined system where healthcare decisions are made by doctors and patients rather than insurance company algorithms designed to maximize profits. However, the private insurance industry and its Republican allies present equally passionate arguments for maintaining and reforming the current system rather than replacing it entirely. They contend that government-controlled healthcare would eliminate consumer choice, reduce innovation, and create the kind of rationing and delays that they claim characterize government-run systems in other countries. The Heritage Foundation warns that Medicare for All would force over 180 million Americans off their current private coverage, arguing that this represents an unacceptable government takeover that would reduce healthcare quality while dramatically increasing taxes. They point to examples from other countries where government-run systems have faced budget constraints, waiting lists, and canceled procedures to suggest that single-payer health care inevitably leads to rationed care. President Trump, despite his previous expressions of support for universal healthcare, has positioned his administration firmly against Medicare for all, calling it a socialist scheme that would devastate American healthcare. His administration argues that market-based solutions, increased price transparency, and targeted reforms can address healthcare affordability without dismantling the private insurance system that they claim provides superior care and innovation. The Trump administration's approach to the current crisis focuses on market-based reforms and targeted interventions rather than systemic change. CMS Administrator Dr. Mehmet Oz announced new transparency requirements designed to make healthcare pricing clearer and more accessible, arguing that informed consumer choice and increased competition will naturally drive down costs. Every person deserves to know what their healthcare will cost without needing a team of analysts to decode it, Oz stated. Additionally, the administration has negotiated voluntary agreements with pharmaceutical companies to reduce prescription drug prices, exemplified by deals with Novo Nordisk and Eli Lilly to lower costs for GLP-1 weight loss medications. These targeted interventions represent the administration's preference for working within the existing system rather than fundamentally restructuring American healthcare. The practical politics of healthcare reform in 2026 reveal the enormous challenges facing either approach. Congressional Republicans remain deeply divided on healthcare strategy, with some supporting targeted reforms while others prefer to let market forces operate with minimal government intervention. Democrats are similarly split between those advocating for immediate Medicare for all implementation and others supporting incremental expansions of government programs. The current crisis has created strange bedfellows and unexpected political dynamics. Moderate Republicans in districts where ACA premium increases are hitting hardest face intense pressure from constituents who depend on affordable health care but have traditionally voted for candidates opposing government expansion. Meanwhile, progressive Democrats argue that incremental approaches have failed and that only fundamental system reform can address the healthcare affordability crisis. State-level responses highlight the federal government's policy gridlock. At least a dozen states are implementing their own subsidy programs to shield residents from premium increases, with New Mexico becoming the only state so far to fully cover all expiring federal subsidies. However, state officials acknowledge that their resources are limited and cannot indefinitely substitute for federal policy solutions. The international comparison debate has become increasingly sophisticated as Americans gain greater awareness of how other developed nations manage healthcare costs and outcomes. Supporters of universal healthcare point to countries like Canada, Australia, and the United Kingdom, where government-run systems provide universal coverage at significantly lower per capita costs than the American system. These systems typically achieve better population health outcomes, including higher life expectancy and lower infant mortality rates, while spending roughly half as much per capita as the United States. Australia's system, which combines universal government coverage with optional private insurance, has drawn particular attention as a model that maintains choice while ensuring universal access. Critics of international systems emphasize wait times for elective procedures, concerns about rationing, and questions about innovation in countries with government-controlled healthcare spending. They argue that Americans currently have faster access to specialized care and cutting-edge treatments, benefits that could be lost under a government-run system focused on cost containment rather than optimal care delivery. The economic analysis of universal healthcare has become increasingly complex as researchers attempt to account for all system costs and benefits. While Medicare for all would require substantial new government spending, supporters argue that most Americans would pay less in total healthcare costs when combining taxes, premiums, deductibles, and out-of-pocket expenses under a universal system. Current American families often face healthcare costs that consume 15 to 20% of household income when combining insurance premiums, deductibles, co-payments, and uncovered expenses. Under most Medicare for All proposals, total healthcare costs for middle-class families would be lower despite higher taxes, while providing more comprehensive coverage, including dental, vision, and mental health services, often excluded from private insurance plans. The transition costs and political feasibility of moving to universal healthcare represent perhaps the most significant practical challenges. Even if Americans broadly support Medicare for All in polling, the disruption required to transition 180 million people from private insurance to government coverage would be enormous, creating opportunities for opponents to highlight individual cases where the transition created problems or delays. The private insurance industry, which employs hundreds of thousands of people and generates billions in profits, has enormous incentives to oppose fundamental system change. Their lobbying efforts, combined with concerns about government overreach and fiscal responsibility, create formidable political obstacles to comprehensive healthcare reform. The employer-sponsored insurance system, while increasingly inadequate for many workers, still provides adequate coverage for significant portions of the population who may be reluctant to change to an untested government system. This creates a political dynamic where those who benefit from current arrangements resist changes designed to help those who are struggling, making comprehensive reform politically challenging even when majority opinion supports universal healthcare concepts. Healthcare innovation represents another crucial dimension of the universal coverage debate. America's private healthcare system, despite its cost and access problems, generates significant medical innovations and attracts top medical talent from around the world. Critics of government-controlled healthcare worry that cost controls and bureaucratic oversight could stifle medical research and innovation that benefits not just Americans, but patients worldwide. However, supporters of universal healthcare argue that most medical innovation is actually funded by government research grants rather than private insurance profits, and that reducing administrative waste could free resources for productive research and development. They also note that pharmaceutical companies in countries with government healthcare systems remain highly profitable and innovative, suggesting that universal coverage need not threaten medical advancement. The 2026 healthcare crisis occurs against a backdrop of broader American healthcare challenges that transcend the insurance system structure. Hospital consolidation has reduced competition and increased prices in many markets, while physician burnout and nursing shortages threaten care quality regardless of how healthcare is financed. Administrative complexity has reached extraordinary levels, with healthcare providers employing armies of staff just to navigate insurance requirements, prior authorization processes, and billing procedures. These costs are ultimately passed to patients through higher prices, regardless of whether they have private insurance or government coverage. Mental health care access remains inadequate under current systems, with many Americans unable to find or afford treatment for depression, anxiety, and other conditions that significantly impact quality of life and productivity. Universal health care proposals typically include comprehensive mental health coverage, potentially addressing this critical gap in current insurance offerings. The COVID-19 pandemic revealed additional weaknesses in America's employment-based insurance system, as millions of people lost coverage when they lost jobs precisely when they needed health care most. This experience strengthened arguments for universal health care that would not depend on employment status, providing security and continuity of coverage regardless of economic circumstances. Looking ahead, the 2026 healthcare crisis may represent a tipping point in American healthcare policy. The combination of premium increases, coverage losses, and growing awareness of alternative systems creates political pressure for significant reform that extends beyond typical incremental policy adjustments. The upcoming midterm elections will likely serve as a referendum on healthcare policy, with candidates forced to present concrete proposals for addressing affordability rather than abstract philosophical arguments about government versus market approaches. Voters experiencing doubled premiums and canceled coverage are likely to demand practical solutions, regardless of ideological preferences. The debate over universal health care versus private insurance ultimately reflects deeper questions about American values and the role of government in ensuring citizen welfare. Countries that have adopted universal healthcare systems made conscious decisions that healthcare access should not depend on employment status, income level, or geographic location, values that conflict with traditional American emphasis on individual responsibility and market-based solutions. However, the current crisis suggests that market-based approaches alone may be insufficient to ensure affordable healthcare access for all Americans. Even supporters of private insurance acknowledge that significant reforms are necessary to address cost inflation, coverage gaps, and administrative complexity that burden patients and providers alike. The resolution of America's healthcare debate will likely determine not just medical outcomes, but economic competitiveness and social cohesion in the coming decades. Healthcare costs that consume ever larger shares of family budgets and government spending crowd out other priorities and limit economic growth. While healthcare insecurity creates stress and uncertainty that affects millions of Americans regardless of their current coverage status. As 2026 progresses, the healthcare overhaul debate will test America's ability to balance competing values of individual freedom, collective responsibility, fiscal sustainability, and practical effectiveness in addressing one of the most fundamental human needs. The stakes could not be higher. The health, financial security, and peace of mind of hundreds of millions of Americans hang in the balance as the nation grapples with whether to finally embrace the universal healthcare approach adopted by every other developed democracy, or to double down on market-based reforms to fix a system that increasing numbers of Americans believe is fundamentally broken.